What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, June 20th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and each of them carry a risk to you. You need a place where you can come and be informed on what's happening with each of these different viruses, where cases are rising, where cases are happening. For example, we're going to talk about measles, whooping cough, several different viruses today, and, of course, some weekly COVID updates. Want to stay informed on this daily? Subscribe down below. Like what you see here? Give it a thumbs up. Share these videos with anyone you know. Leave a comment down below. And remember, hit that notification bell, because by doing that, you'll know when I do my daily update. Alright, starting off today. Today is a relatively busy day. We have a lot of news to look at, a lot of data. Some of the data which is lagged from yesterday. Yesterday was Juneteenth, so some things did not update. So you may see a couple things that say, oh, that looks big and scary. It's because there's a lag from yesterday. Alright, starting off here. Oregon health officials confirm third case of measles in Oregon. Now, I don't recall if we already shared this. I seem to recall that we talked about Oregon having 2 cases. Now there's 3 cases. This got added to the website last night, and I will be showing you the website in a moment. Moving on to our next story now. Montreal Public Health warns of whooping cough in schools. So apparently there have now been cases up in Montreal in schools. That seems to be not a good thing. And then in Lexington, Kentucky, Fox 56 is reporting a pertussis whooping cough outbreak continues to circulate in Fayette County. So this is not good. And it says here that there have been 32 cases of whooping cough since April 26. So that's a number that continues to rise. We've been talking about Kentucky a few times. And in Australia, in New South Wales, whooping cough and pneumonia strikes young Aussies as health experts issue urgent warning to parents. So whooping cough issues over in Australia as well. Also in Australia, there's a health warning for South Australia after 3 cases of highly infectious Mpox virus are reported in the state. So, remember a couple years ago we were talking about Mpox a lot? We actually did a couple of videos dedicated to Mpox. Well, we're not going back to that, but hey, it is still out there, and it is still being found now in Australia. Up to 3 cases, and from time to time, we do see it in wastewater when we check the wastewater levels for the United States. Alright, taking a look at this. Not the biggest poll that we've ever done, but it's a poll. It only got 70 votes. We're going to be doing another poll again today that I guarantee you is going to get way more than 70 votes. We'll talk about that one in a moment. Do you know of people out sick at your workplace? If they are constantly out sick, leave a comment down below. This poll and some answers may be used on the next pandemic update. We'll just go with the results. 74.3% said yes. 25.7% said no. Out of 70 votes, I'm going to be doing another poll today on X. This time it's going to be, do you think universal masking should be mandated in healthcare facilities? Tell me what you think. I'll tell you my vote. Yes. Why? Well, remember what the theme of yesterday's update was? How increasing number of people showing up at the hospital or even doctor's offices positive for COVID means there's more infection that could be circulating in a healthcare facility. Well, that's good enough reason for me to believe that there should still be masking in healthcare facilities. I get it. People are done with masks. They don't want a mask in the store. They don't want a mask in other places. Okay, but could you at least agree to masking in healthcare facilities? I mean, it's just a simple thing to ask to help keep those who are at risk safe. Please. We'll put that poll up today. We'll show you the results of it tomorrow. I got a kind of an idea in my head of where that one is going to go. Taking a look at this. The KP.3 variant is causing trouble on the West Coast. This is from Eric Topol. don't show his stuff too much, but in this case, I think it is warrants us giving this this graphic here, a look at. And we can see here, the West Coast. There clearly is something going on in the West Coast that is not being seen in the rest of the country. Yes, the rest of the country had a little bit of a rise. For the most part, it has leveled or even dropped a little bit. But the West Coast, because you got Hawaii, Alaska, California, places that I've seen rises. And we're going to be taking a look at some new data from Washington today as well. We'll get to that in the second half of this video. Alrighty, we have to look at the website. See this red over here, data report? Hey, that's me. Yeah, I added a ton of things last night. Things that we were just behind on. Or things that I found last night. And we want to scroll all the way down here to the sports health section. And we want to click on the sports health section and go to 2024 MLB illness cases. And we can see here, I've been tracking MLB illness cases. Started this back in May. I got a little off on it for a while, so there may be a few things here that I missed. There was a time period where I just stopped looking at it. Well, yesterday, when I did my Google search, typed in illness, I said, interesting. There was an MLB player sick. Well, we found 3 new ones. That's right, 3 new cases. One was with the Rockies, there was another with the Cardinals, and there was another one up here as well. Let's see, where's it at here? With the Angels. So there were 3 new cases, and you know what? Illness is starting to circulate once again, and I did a search this afternoon. I've already found another one that I think I'm going to have to add. Hey, if you want to check out my website, it's datareport.info. We archive stuff like this. We also archive COVID studies, as you can see here. I've been adding to that. Need to get back to adding to that. I'm a little bit behind. And we also keep track of COVID positives. Remember Glenn Close tested positive for COVID and RSV at the same time? Well, that falls under actors and actresses. You click on that and you get a list of actors and actresses that have tested positive since I started my website. Now, mind you, not everyone is public about their case. So this is not really a complete archive. And again, stuff that's from before I started the website is not necessarily in there. Maybe one of these days I will get around to adding it. Trust me, it would be a big list of people, especially if we go to political figures. There actually is a website that has political figures, but it stopped. I believe it stopped in late 2022. One of these days we'll get around to adding all of them. That way we have a complete archive, or at least the best we can do. Alright, moving on. The UK did update today. Well, partly updated. What do I mean by that? First off, cases did go up today. And this case is number 2,053. That has to be a significant undercount. It's up by 149. That's up by 7.8%. Why would that be a significant undercount? Take a look at the number of deaths. 139 deaths. So you're telling me 2,053 cases, and yet there are 139 deaths? Well, heck, that's a high death ratio. That means a lot of people don't report their case. Maybe the at-home test. They used to have a system for reporting the at-home tester. Is that even still a thing anymore? Someone let me know down below. I forget what it was called. They used to have a system. I think that went in the dark, didn't it? That went to sleep. It's no more. And, of course, healthcare. They have not updated the hospitalization since May 29th. So we can't say it's showing down, but that didn't update. So with the cases going up 2 weeks in a row now, you have to think at least there is a minor increase in healthcare. Who knows? And again, these cases, it's probably 2, 3, maybe even 4 times that amount, just based on the number of deaths that they're having. 139, that's quite a few deaths. So, yeah, you can get where I'm coming from here. And you can see on the chart here, they are seeing a little bit of an increase in cases, but it's not a significant increase. It's just a slow and steady increase at this time. And they are not even higher than the peak that they had in May. That was actually higher than where they are right now. So that actually is a good thing. Got to point out the positives once in a while when need be. All right, taking a look at what's going on with the pollen levels. Drum roll, please, as I refresh this. And we're up to 47% of the country that is in low to medium status. The southeast is doing the best. the Pacific Northwest is doing the worst. You can see here, there is some orange, there is some red, indicating high levels of pollen in Oregon. Day after day, we keep seeing that. And we're also seeing some orange in portions of Cape Cod area, just south of the Boston area. And south and east of there, Rhode Island, you're in the orange. That's not good, because as is, your heat indexes today are over 100. In fact, I saw in southern Maine, I believe it was York, Maine, or Portsmouth, New Hampshire, I saw on the map, a heat index of 109 degrees. Couple that with the pollen, and yes, we have to take a look at air qualities as well. Unfortunately, they're not so great either. It's not a good day for people who have breathing problems in the northeast U.S. And you know what? Quite frankly, it's not a good day in the Great Lakes either. You can see here, yeah, look at that. You're seeing some oranges in Maine, New Hampshire, portions of Massachusetts, oranges and yellow in Vermont, Connecticut, New York. Ohio's even showing a few reds. In fact, no, that is western Pennsylvania. But look just northeast of Cleveland area, like up around Chardon, Ohio, those areas. Yeah, in Pittsburgh. Wow, your air quality is really bad today. So that is something to be concerned about. Limit your time outdoors. The heat, the pollen, the bad air qualities. If you do not need to go out in these areas, please don't. I'm not telling you that you need to lock yourself to the house. I'm telling you, you need to be in the air conditioner. Heat stroke, respiratory difficulty problems, they all happen at a higher rate when it is this hot. Taking a look on the west coast, you can see here, air qualities are not great out there, and that's going to be the case for a long time to come because wildfire threats continue in California. It is really dry there. Heat-related illness map will continue to fill in across the country. Want to learn more about climate and the weather? I have another place where you can do that. It is Climate Data Report over on X, and you can see here we're starting to grow there, so that's a good thing because I like to keep people informed. And another place where we are growing a little bit, let's refresh this, is over on our other YouTube channel, Climate Data Report, where I did today talk about the extreme heat is starting to cause drought conditions for many. That includes the west coast, but if you take a look at my thumbnail there, you can see there's some drought conditions in the east as well. That's not a good thing, and I'm actually concerned about that. No real signs of heavy rainfall. All right, moving on to this. Philadelphia, 806 EMS incidents reported on Wednesday, and they did correct this today. The 800 is in front of EMS, not in front of fire incidents, and I'll take that 806. For how hot it is, I think this number could have been worse, so that's actually a good thing that we're not seeing it coming higher. Taking a live look at Montgomery County, Pennsylvania, we do see Upper Merion Township. It's out in the main line area. Cardiac arrest at this time. Heat exhaustion. There you go. A heat-related illness in Cheltenham, Pennsylvania. And we do see respiratory emergency and a few other things over in Chester County, Pennsylvania. Let's refresh this. Wow, very busy. Hemorrhaging, sick person, injured person, fall, let's assist. Overdose, injured person, heart problems, respiratory difficulty again, sick person, seizures, unconscious person. Yeah, it's a busy day. It's the time of year where heat-related illnesses start up, but all these are not even heat-related illnesses. Taking a look at Pennsylvania, it says it updated today, but for the most part, for wastewater in Pennsylvania, pretty much remained the same. All the places that were seeing an increase are continuing to, and in Westmoreland County, Pennsylvania, there continues to be a large increase for COVID at this time. Walgreens this week. Then we'll take a look at wastewater real quickly. National positivity rate at Walgreens this week is 30%. The prior week was 27.1%. Difference of up 2.9%. Total test 4,366 versus 4,213. We went through a bunch of states the other few days. We got a lot more stuff to get through, so we're not going to go through any states. But I do quickly want to update the what's going on with wastewater scan. We will go to the national level here if we can. And I do want to see if they made that correction today. Let's take a look. Nope. It's still showing this straight upward motion on wastewater scan, which we know is not true. It is incorrect. It will eventually even itself out. Hopefully it does that tomorrow or before the weekend. Yes, it probably is rising, but no, it is not rising straight upward like that. So if you're headed over to the wastewater scan site and you see this, please do not take that seriously for COVID. It is likely wrong and overdone. All right, moving on. Taking a look now at some CDC data. This will update tomorrow. The KP.3 variant is now 25% of the cases in the United States, and KP.2 is at 22.5%. This and all the other CDC data will get a full update tomorrow. Therefore, we're not going to show any more CDC data for today. Taking a look at New Jersey for today. With 64 out of 70 hospitals reporting, they do come in with 207 hospitalizations, 9 people on a ventilator, 28 people in the ICU, and 49 discharges. Alright, remember yesterday we said New York State was probably going to come in with a high number on Thursday. Well, boy, did they ever. In fact, I think this is the highest number, 1,544 new cases. Let's see, how far back do we have to go to find a number this high? We have to go all the way back to the end of February is the last time that they were this high. Multiple reasons. Juneteenth was yesterday, some backlog, although it looks like here it is completed, like every day in a row is being reported. I'm not seeing. Yeah, there may have been a couple days that are. The point is, Juneteenth was yesterday, plus it is Thursday, which means New York City's cases get added in. When that happens, the number always looks a little bit higher. What we did not get today, and I'm really hoping we'll get tomorrow, is an update on the hospitalizations in New York State. We still go back to June 17th, where it was 634 people in the hospital and 46 people in the ICU. All right, Colorado today. Some good news in Colorado. Good news, bad news, but let's start off with the good news. Your hospitalizations, 84. That is down by 12. However, the positivity rate is up by 3.1% to 9.3%. Total number of cases is up slightly this week, 943. That is up by 42. And emergency department visits diagnosed with COVID, flat. That's 0.7. Good to see that your hospitalizations are down despite the increase in cases. As we know, hospitalizations do lag cases. And as we know here, taking a look at the chart, see they've been in an up down regimen. So maybe it'll come in a little higher next week. Even at that, cases are up and you did not see a significant increase. I think that's a win-win scenario, although it's never good to see cases go up because only one case, that's all you need. One case can give you long COVID. All right, we have to take a look here. LA did not come in yet. It usually comes in well after our Thursday updates. Connecticut, nothing really to report here. 54 COVID cases, 17 influenza, and 4 RSV. They don't really update all that often. The last update was June 1st, so we can just forget about that. 8.1% of the emergency department visits in Massachusetts, or actually, correction, it just updated on us. 8% even emergency department visits are for respiratory disease in the last week. Skipping over now to Washington, and in Washington, 1% of emergency department visits are for COVID. That's up by percent change in the last week. 18%, 0 influenza, 0 RSV, and we can see here, influenza down 33% for hospital admissions, and COVID, 2% of the admissions are COVID. That's up 15%, 18 people in the ICU for COVID at this time. Alrighty, I want to show you something here that I don't know if we've ever showed this to you. We can actually go region by region in the Chicago metro area, in the city of Chicago. So let's take a look at some wastewater sites there. And we can see here, 125th Street sewer shed. And it says here, generally COVID-19 viral levels in 125th sewer shed has been rising past 3 weeks. Well, I'm not seeing that at this time. And this was updated on June 12th, so that one is not rising. Let's go over to Austin, Montclair. This site is seeing a rise at this time. Remember, this is the Chicago area. In Chatham area, or I think we're saying that correctly, Chatham area of Chicago, slight increase there. And we're not going to do every wastewater site. Here's Chicago Lawn, Ashburn, which at this time is showing an increase. And I should mind you, it does actually show population for each of these wastewater sites. Chicago, you're really on the ball here with these wastewater pages. Why can't other cities, like my own city, become this on the ball? Philadelphia, we get an update once a month. And maybe this doesn't update every week. I don't know. It's updated on the 12th. But the point is, you get very detailed with your data here. Let's continue to come down here. Lakeview, Uptown. What's going on there? Starting to see a bit of a significant increase in this area, 54,000 population. Lincoln Park, near Northside. What's going on there? Wow. That wastewater site is actually starting to go upward, but again, it's not as high as it was in the winter. All these sites are lower than what they were in the winter, and let's just do one more. Let's go down here to North Branch and see what's going on there. And in North Branch portion of Chicago, that is starting to see a rise at this time. Finally, before we end today's update, I did want to add this in. Someone mentioned that Delaware still had a dashboard. Surprise, they do. In Delaware at this time, we can see here, things are not doing too bad. Hospitalizations are relatively flat. The average number of people in the hospital with COVID-19, 13.6, and it just rised ever so slightly. It was at 10, now it's at 13.6. That's not a big number. And Delaware's not one of the bigger states, but hey, that is not a big number. Alrighty, folks, that does it for the Thursday edition of the Pandemic Update. We'll have another Pandemic Update again tomorrow with new COVID variant data, new CDC data, and the news of the day. If you enjoyed this update, give it a thumbs up. Want to see more updates like this? Subscribe down below. It's the best way to help keep yourself safe and informed with what's going on with all these viruses that continue to wreak havoc. Hit that notification bell, share these videos with anyone you know, and if you have a comment on anything you saw today, I expect to see some comments on my mention of masking in healthcare. Leave them down below. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Thursday afternoon. Thanks for watching.